What if one of your body's most important organs was crying out for help, but you just didn't know how to listen? Well, today we're gonna learn how. We are tuning into the silent signals of your liver. All right, let's start with a number. Over 500. You know what that is? That's roughly how many vital jobs your liver is doing for you every single day. I mean, it is an absolute powerhouse.
And that really is the million-dollar question, isn't it? Because here's the thing about your liver. It's a silent worker. It just gets on with the job, no complaints. Which is amazing, right? Until it's not. So how do you know when this silent hero actually needs your help? Okay, so first things first. To really get this, we've got to give this organ the credit it deserves. Before we can listen for trouble, we need to understand just how much it's doing for us, day in and day out. Think of it like this. Your liver is your body's main filtration system, its own chemical processing plant, and a metabolic powerhouse all rolled into one. It's working 24/7. Seriously, it filters out the bad stuff, helps you digest your food, stores up energy. I mean, it's handling everything from that morning coffee you just had to keeping your cholesterol in check. It just never, ever clocks out. So what happens when this silent hero gets a little overwhelmed? Well, it starts sending out signals. They're pretty subtle, kind of like an SOS message. So let's learn how to read them, shall we? All right, the first batch of clues, these are the ones you can actually see. And, because of that, they can sometimes be the most surprising. So let's break these down a bit. First, that yellowing of the skin or eyes, that's called jaundice. It basically happens when the liver isn't clearing out this stuff called bilirubin from your blood, so it starts to build up. Then there's the easy bruising. What's that about? Well, it could be a sign your liver is having a hard time making the proteins you need for your blood to clot properly. And finally, that swelling in your legs and ankles, or edema. That can happen when a struggling liver isn't making enough of another protein, causing fluid to kind of leak out where it shouldn't. You see, these aren't just little cosmetic issues. They are your body trying to get your attention. But not all the signals are on the surface. Some of the most common ones are things you feel deep down. And this is where things can get a little tricky, right? Because things like fatigue or nausea, they're super common. But the key here, the thing to really pay attention to, is the pattern. We're not talking about feeling wiped out after a crazy week at work. We're talking about a kind of deep chronic fatigue that just sticks around. Or maybe you've lost your appetite for a while, or you just feel kind of queasy a lot. And that pain or discomfort in your upper right abdomen, yeah, that's exactly where your liver lives. It's another one of those whispers. And that's really the big takeaway here. These signs, they're whispers, not shouts. Your liver usually doesn't start shouting until things are pretty serious. So that's why paying attention to these little whispers is the first, most important step. Okay, let's switch gears for a second and talk about a huge myth. This is one that honestly stops a lot of people from even thinking about their liver's health. Yeah, this is a big one. The myth that only heavy drinkers get liver disease, the fact that is absolutely not true. Look, while alcohol is for sure a major factor, so many other things can cause liver issues. Your diet, viruses, your genetics, even being overweight. In fact, non-alcoholic fatty liver disease, linked directly to diet and obesity, now affects an estimated 1 in 4 people worldwide. So it's your whole lifestyle that matters, not just one single habit. So we've talked about how to listen for the signs, but what can we actually do to help our liver? How can we support it? Well, the good news is it's probably a lot more straightforward than you think. Really, it boils down to these 4 key things. Step 1, eat a balanced diet. Lots of fruits, veggies, fiber, all the good stuff. That gives your liver what it needs without overwhelming it. Step 2, limit alcohol. Just giving it a break can make a huge difference. Step 3 and 4 go hand in hand. Maintain a healthy weight and stay active. These are probably 2 of the most powerful things you can do to stop fat from building up in your liver. These are just simple foundational habits, but they're so important. This really says it all. Your liver supports you silently. Learning to listen is how you support it back. It's so true. It's a partnership. Your liver is always there for you, working away in the background. Learning to listen is how we can be there for it. And that brings us to maybe the most important point of this entire conversation. This is all about awareness, okay? Not self-diagnosis. So if any of those whispers we talked about sound familiar, please, the single best thing you can do is just talk to a doctor. An early conversation is absolutely key. So I'll just leave you with this question. Are you listening to what your body might be trying to tell you?